So we're still working on completing the client profile, and we're just getting the client to fill out the PAR-Q. Make sure they're reading the questions and that they're answering it yes or no. So the first one, has my doctor ever said that I have a heart condition and that I should only do physical activity recommended by a doctor? So we'll fill this in as if it's my brother, and the answer for this one is no. Does he feel pain in his chest when he completes physical activity? No. In the past month, has he had chest pain when he was not doing physical activity? No. Does he lose balance because of dizziness or ever lose consciousness? No. Does he have a joint or bone problem, for example, back, knee, or hip, that could be made worse by a change in his physical activity? No. Is your doctor currently prescribing drugs, for example, water pills, blood pressure tablets? No. And does he know of any reason or other reason why he can't participate in physical activity? And the answer there is no. And then on the next page, he has to sign this. So he'll print his name, David Small, and then I'll need a signature, which should be an ink signature, but we're working electronically on this one. So we'll have D. Small and the date. So the date today is the 10th of the 7th, 2015. Now, because he's over the age of 16, he doesn't need a parent or a witness here to sign this, but it's always good practice for the student, or me, the student, to sign this as well. So I'm going to put trainer, and I'm just going to do an italic A dot small, just to show that I've signed this and I've read this PAR-Q. Now, the next thing I need to fill out is the informed consent, where he's agreeing to participating in a training program and also carrying out the fitness testing that we're going to do. So the client will have to read through points 1 to 6, make sure they're happy with them, and then they'll put their signature in here. Oh, we may need to insert a text box for this. So I'll put a little text box in here. So client signature, D Small. Print his name in here. Oh, we're losing the formatting of this. Print it. Make it a little bit bigger if it allow. Okay. We need to date it as well. So 10th of the 7th, 2015. Now, the trainer, which is me, the student, I need to fill in here as well. So I have actually got to put my information in a box there as well, which I'll do. So I'll just make that a little bit bigger so that you can see it. Ooh. And there we go. So the informed consent has been completed. We're still working through the client interview and analysis. So now we need to summarize my client's attitude and motivation towards exercise. This is a key part of the consultation, whether it's for this case study or whether we're out there working in the industry. So I asked my brother to briefly summarize his attitude and motivation towards exercise, and I get the following information from him. I am motivated to make a change to my program as I have become a little bit stale in the gym. I'm motivated to get bigger and improve my CV fitness. What current barriers does my brother have? Well, work commitments, and I can't train in the evening on football days. Fair enough. There's ways of overcoming these. Now, this is where you work with your client to make sure that you've thought about, well, okay, you've got a barrier there, but we might be able to move it or work around it, and how can we do that? So if we're thinking about work commitments, one thing that we could do is train before work or at lunchtimes. Again, I'll change the font back to that. And on football days, train weights earlier in the day without training CV. So now we need to think about what state of change is my client at. So we're thinking about my brother, and we need to be thinking about both for nutrition and also for fitness. Now, the ones that we've got to choose from are pre-contemplation, where he hasn't even thought about making any changes. We've got contemplation, where he's been thinking about making some changes. We've then got action, where he's been making changes, maybe they're nutrition changes. He's been performed those changes for about 2 weeks, or he's been going to the gym on a new program that is going to help him get the body that he wants, or the goals that help him achieve the goals that he wants, and he's been doing that for a couple of months. Or he's at the maintenance section where, you know, he's been training for 3 to 6 months. He's on track for his goals, or he's achieved his goals, and he just wants to maintain his performance. And then we've got termination, where he's no longer training and not been training for over a month. And then we've got relapse, where he's just gone back into bad habits. And it can be different for both nutrition and for fitness. So here I'm going to put that he's at preparation for nutrition and fitness. And then I need to justify how I've come to that decision. So for this, David is ready to make changes to his training program and nutrition to achieve his fitness aspirations. And that will just sail through. That's absolutely fine. So before we move into SMART goals, I'll pause this video and we will create